Good afternoon. Thanks for taking my question. Just wondering if you could expound a little bit more on what you mean by, things could change or be even a different place by Family Day on February 21st. Does that mean lifting restrictions, or are you talking about just, bending the curve more and hospitalizations being down?
I'm talking about all of those things. We are making our way through this Omicron wave. It is different yet again, and there are measures that we put in place in December to address some of those higher risk settings and to give us time to understand Omicron more. So yes, we are seeing the peak, I hope, in our hospitals right now. There is a strain on our hospitals. We don't expect to see the census drop for some time, but we're also at a point where much in the community is changing, and people have a level of immunity because we've stepped up for booster doses. So yes, the orders, the most recent orders, are due for review on February 16th. And before February 16th, on February 15th, we'll be talking about those. And if we are continuing on this trajectory, then yes, I do hope that we will be able to lift some of those restrictions and gradually get back to those needed connections that we have. As you know, most of the restrictions right now are on social gatherings and social connections. And I am looking at Family Day as a time to start getting back to not opening things up completely, because we know, and we've seen that around the world, that when you do things precipitously, you can get a rebound that can be really hard on people. So hard on us, because we start to see more transmission again. So what we will do, and we've been working with the different sectors who are affected about plans for a gradual reopening and coming back together. And I see Family Day as one of those next steps.
Gordon, do you have a follow-up?
I do. You mentioned, I think both yourself and Mr. Dix mentioned about encouraging people, whether it's children 5 to 11, their parents to book them and get a vaccine, or on the booster side. Is there anything that the province can do in terms of initiatives or whatever to try and, try to move that forward? I mean, I see that BC is behind some provinces on both of those fronts.
Yeah, so we are, well, on the booster dose front, we're actually in a pretty good place. But you're right, we have been doing a number of initiatives for children, particularly 5 to 11. We've been working with Children's Hospital, and there was a number of webinars and other things yesterday, working with family docs about how we can make it part of their role and involve them more in providing vaccinations for young children. I think that's a really important thing. In certain communities, we're reaching out through schools to give opportunities for younger children and all school-age children. So there's a whole variety of things we are doing on that. In terms of boosters, I think there's a we've seen that infection spreads rapidly amongst that highly connected younger age group. I will also say that the 18 to 29 age group is the one that has after 80 plus, where we have 90% in the very high 90s of people getting their booster doses, that young people are stepping up and getting vaccinated, and that's made a huge difference in post-secondary institutions, in workplaces and other places. And I need to encourage all of you to get your booster. It's not only for now. These booster doses, we now know, are especially after that 6-month interval, and there's a study that was published at least I read it yesterday, it came out in the last few days, that really supports that 6-month, or at least 5 to 6 month interval between second dose and the booster dose, again, gives longer lasting protection. So that's going to help us with whatever comes next, so we don't have to have some of the measures in place again that we've had to see in the last few weeks and months. So yes, everybody step up, get your booster dose. It's good for you, it's good for getting us out of this pandemic and getting us out of this wave, and it's going to be important for us for what comes next.